Hello, I am Will Mahnke, a student of behavioral science at Liberty University. This discussion is for CEFS 501 and it is on ethical violations. When reading the article, Sanctions Licensing Board Violations for Marriage and Family Therapists Spanning a 10-Year Period, Rollins and Grames, 2021, one can learn ethical violations over the course of this 10-year study. Some of these examples include, for psychology violations, continuing education violations, 41%, sexual contact with clients, 10%, and non-sexual boundary breaches, 10% as well. Under the category of counseling, violations, unlicensed practice and misrepresentation of credentials, 19.3%, breach of ethical standards, 11%, and sexual relationships with clients was 9.4%, practicing beyond their scope of practice was 7.8%. Marriage and family therapists, reporting was a little bit different and a little more difficult to interpret. From what I understood, that out of the 17 members that were expelled, 7 were expelled for sexual relationships. Other violations included harassment, therapist impairment, confidentiality breaches, false advertising, and sexual misconduct. The violation that I found most surprising was the amount of DUIs or inappropriate substance use with counselors and therapists. It showed 298 offenses of 24% of the total offenses from this study. One of the things that's kind of scary to me is this is only the cases that were convictions. It doesn't account for things such as suspended impositions to a lesser plea or plea bargains that reduce the charges of, say, like a DUI to a lesser charge or drug use to something different. The state that I live in, South Dakota, uses the American Counseling Association 2014 for their standard code of ethics, and there are no known code of ethics that can be found for South Dakota specifically. For the offenses that I found surprising, DUI and other drug use, the code 1.6, reports of unethical conduct, and the American Association for Marriage and Family Therapy, AAMFT 2015, could apply. According to this and how it's written, it seems that if the therapist was under investigation and awaiting trial for a DUI or drug use, it should have been reported. The code specifically uses the word alleged, not convicted. Therefore, once they're caught and it was alleged against them, it should have been reported. Now, we don't know if they did or not. This is just an assumption that could apply to that code. One could assume that if a therapist were driving under the influence of alcohol or a substance, they have a problem. The AAMFT 2015 Ethics Code 3.3 says to seek professional assistance for things that may impair performance or judgment. Having issues with alcohol or drug use would be considered one of those problems. In this case, I do hope that they would reach out for help, whether they have a serious problem or a minor problem. If they're getting a DUI and they're a counselor, I hope they reach out to somebody for help. The last code that could apply in the case of the DUI or drug use is where the AAMFT 2015 gets serious. I mean, they put the hammer down on this one. With 3.12, the code uses the terms that could indicate DUI or substance use violations, could mean expulsion from the AAFT or licensure, could have a long-term effect on that therapist. If any of the DUI offenses occur 3 times by one individual, it could be considered a felony in many states, which is also under this code. If you have a felony, it could bounce you. And even at a misdemeanor, if it hinders qualifications and functions as a therapist, it gives validity to the offense fitting within this code, which could very well result in expulsion or licensure issues. In regard to the American Counseling Association 2014, there are a couple ways the ACA C2H impairment can apply to the mental health professional who gets a DUI or has inappropriate substance use. If they're using substances or drinking while driving, are they using when with a client? This doesn't necessarily mean are they drinking or using in the office. It could present a need for an investigation. However, what are the emergency protocols for the client? A lot of therapists, a lot of counselors will allow their clients, and this is from personal experience, to call them after hours in the event of an emergency. Well, if you're drinking and driving, if you get caught doing it, common sense would say you're probably drinking at other times as well. You're impairing yourself from what you should be doing with your client if you have this function set up. Similar to the AMFT, the ACA code also states that if there is a problem that causes professional impairment, they are supposed to suspend or limit their professional responsibilities. This code also stated that if there is a problem that inhibits the therapist, they are to go to colleagues, go to supervisors, or go to professionals to help out with this problem. When thinking of themes that many of the violations had, the obvious one is the term failure to. Another theme that I see comes from people being complacent. It seems if one continued to be diligent in their profession and had others to assist with accountability, there would be much less violations. The last prompt, when thinking of impairment, according to Remley and Herlithy 2020, the figure 7.1 shows that alcohol and drug use are cause for alarm for impairment when done by mental health professionals. Now, I don't know if in this case, are any of them more than just alcohol or substance use. In this context, the level of use, abuse, or addiction should be further investigated. It seemed that if a person maintains self-care, humility, integrity, accountability, with help from others and supervision, and does not become complacent or allow themselves to feel burnout, it is much less likely that they are going to breach legal or ethical boundaries. Thank you for watching, and may you be blessed.